morning. October being a Breast Cancer Awareness Month, we welcome you all in our today's exclusive interview on breast cancer awareness and prevention. Today, for this exclusive interview, we have one of the eminent senior medical oncologists from Pune, Dr. Tushar Patil, working as a consultant medical oncologist and hematologist at Sahyadri Hospital, Jupiter Hospital, Surya Hospital, and various other hospitals in Pune. He is also attached as a visiting consultant to Integrated Cancer Treatment Center at Vagoli and doing various clinical trials for integration of Ayurveda and allopathic in cancer treatment for patient benefit. He is an associate professor at Bharatiya Vidyapeeth Medical College and working as a PG teacher there since 2011. He did his medical training from the prestigious BJ Medical College, Pune, and later went to the prestigious KEM Hospital, Mumbai to complete his MD medicine. He further completed his super specialty training in medical oncology and hematology from one of the premier cancer institutes in India, GCRI, Gujarat Cancer and Research Institute, Ahmedabad. He secured first rank in university DM exam and was a gold medalist. We welcome you, Doctor, for this exclusive interview and thanks for sharing your valuable time with us today. What is breast cancer?
Breast cancer happens from the tissue of the breast. It's a modified sweat gland, and hence the glands sometimes undergo mutation. And these mutations, when pile up because of erratic growth, uncontrolled growth, that is the time when breast cancer develops from a small cell to mutated ball of cells. And then once it becomes large enough, it spreads to other organs like axillary nodes, lungs, liver, bones, that is called metastasis. Friends, in India, that is in urban India, the ratio of breast cancer is close to 1 in 22 or 1 in 25. Hence, after every 25 females, one female runs the risk of development of breast cancer in her entire lifetime. The same ratio in US and Europe is close to 1 is to 8. But because of rapid urbanization, industrialization, many hormonal factors and other factors in the environmental which are changing, this ratio is rapidly increasing in country like ours.
What are the risk factors of breast cancer?
The risk factors of breast cancer can be divided into two. One is modifiable and the other is non-modifiable. In non-modifiable risk factors, we have genetic and a family history where no one has control over it, and hence these are non-modifiable risk factors. Modifiable risk factors, of course, are many. First and foremost, being your lifestyle. So, obesity predisposes a women to higher risk of breast cancer because of increased obesity, increased fat content, is increased estrogen in the body. Lack of exercise, various addictions also predispose a little bit towards development of breast cancer. Some drugs, especially taken for treatment of infertility, may cause a hormonal imbalance and cause increase in the risk of development of breast cancer. Similarly, factors like early menarche, late menopause, no or late childbirth, no or very less breastfeeding all increase the action of unopposed estrogen and hence predispose a woman to development of breast cancer.
What symptoms should she look for?
First and foremost, breast cancer symptom would be lumps. So lumps appearing in the breast or in the axillary or region, that is armpit region, or in the neck region. Any redness thickening over the area of the breast, any nipple discharge, especially if it is bloody nipple discharge, should prompt you to go to the doctor immediately and get examined. Any lumps appearing otherwise in the area of breast, associated skin thickening and associated skin changes should be consulted to the appropriate doctor immediately. Other symptoms sometimes appear in 25% of the females when the cancer spreads to other organs. So 25% of the females still come to us with a spread out disease where the disease is spread to the bones or liver or the lungs, and the symptoms are likewise appearing like bone pains, jaundice, or causing breathlessness, coughing, or sometimes fluid, that is pleural effusion in the lungs.
What are the new screening guidelines for breast cancer?
Two or three very simple tools: mammography or sonomammography for younger females to tell us about the exact location of this tumor, also the types and characteristics of the tumor, also screens the axillary part or armpit part to know whether these region is involved. The second test is, of course, biopsy. That is a tissue diagnosis. Whenever we have a suspicion of breast cancer, the biopsy or FNAC should be attempted to know the exact status of cancer. Biopsy or tissue diagnosis is one of the most important ways of confirming cancer, and in this also we look out for various subtypes and molecular classification of breast cancer to exactly know the aggressiveness of this tumor and hence define what kind of tumor it is. So tumors behave differently in young females and in older females, and they have different characteristics. Also, our treatment plans change based upon these tumor characteristics. Hence, a tissue diagnosis again is very important apart from sonography or mammography. Other tests like X-ray, sonography, CT scans, or PET scan can be done if we are suspecting that the disease has spread beyond the breast tissue.
What is BSc and why is it essential?
So any female who is around 15-20 years of age can do this breast self examination. Once the 5 or 6 days of menses are over, can self palpate the breast. Various videos are available about the techniques of breast self examination, how to examine the breast, and if there is any suspicion found of any lump, consult your doctor.
What are the general treatments?
Today, treatment has advanced to a very great extent. We have surgery for breast cancer. From radical surgeries, where we were doing extensive surgeries, we are now moving to breast conserving surgery, where only a part of the breast cancer tissue affected is removed along with the nodes. Also, we are moving to plastic and oncoplastic surgery, where we are trying to restore the shape and the size of the breast, making them look more symmetrical for the patient from the feminine point of view. Hence, today we are more focused not just on survival but also quality of life and preserving the femininity. We also have various advancements in the other treatments like chemotherapy. So most of the chemotherapies today are daycare chemotherapies. Patients comes in the morning, goes back by the evening. 2 or 3 days, patient resumes her duties. Most of them have minor side effects which can be managed at home. No major concerns are there as regards the short term and the long term toxicities. So most of them do not have nausea, vomiting, and mouth ulcers. Though hair loss does occur in some of these patients, there are now cooling caps which are available, which can be made available to decrease this or prevent this hair loss from happening. Most of the other side effects like WBC going down low, higher rates of infection have been totally prevented with the modern use of supportive treatments that are available. Similarly, the other treatment, radiation, has undergone major advances. From treating radically the entire area, we are treating focused radiation. From our cobalt machines, which were giving higher radiation to adjacent organs, we are now giving very specific radiation to the organ involved, and at the same time, and not having any damage to the underlying organs like lungs or heart. So, radiation techniques have evolved tremendously and radically to treat the patients at the best and also to prevent any long term complications happening.
Can breast cancer be prevented?
The most favorite of our any oncologist topic is the prevention or screening of breast cancer. Friends, prevention is the only way, or screening is the only way to decrease the mortality and the morbidity associated with breast cancer. We have three tools for doing this. First is breast self examination. So, any female who is around 15-20 years of age can do this breast self examination. Once the 5 or 6 days of menses are over, can self palpate the breast. Various videos are available about the techniques of breast self examination, how to examine the breast, and if there is any suspicion found of any lump, consult your doctor. The second is clinical breast examination that happens by the gynecologist or your primary care physician. That has to be done every 6 months or every 12 months. The third most important is screening mammography or screening sonomammography. Mammography is recommended for all females who are above 40 years of age once in a year. It is nothing but an X ray of the breast in two different views taken and read on a scale of 0 to 6, which is BIRAD scaling, and this scale gives us an adequate information how to proceed further. So for a screening rate, or what we say a scale of 3 and above, which is suspicious, we go with other investigations like biopsy or a more frequent scanning. Some females where the breast tissue architecture may not be preserved because of prior treatments, an MRI of the breast may be advisable for females, especially for picking up very, very small tumors which may not be palpable either by the breast self examination or by clinical breast examination. So, three tools: breast self examination, clinical breast examination, and a mammography or a sonography are highly recommended.
Thank you so much, Doctor, for upgrading us with such valuable knowledge and surely be help in spreading awareness for breast cancer and will surely make women aware about early detection of breast cancer.